Good afternoon to all of you. Today I am going to talk about asepsis and disinfection. This is the apt time to talk about this topic, that is asepsis and disinfection, as the whole world is battling against a coronavirus pandemic. You know, today the scenario is even the layman is made aware of significance of some of the aseptic procedures like hand washing, what is social distancing, wearing mask, etc. So why it is so important? That's because this virus is highly infectious. Mortality rate is very high. In India itself, if you see, it is 3%, and in Western countries it is much more higher. The vaccine is yet to come. No proper treatment protocol still available. Yesterday itself, you would have seen in paper plasma therapy. One person has died when he is treated by this protocol. So only the best option that is available to us to protect ourselves from this pandemic is personal hygienic measures like frequent hand washing, wearing masks, and for the healthcare professionals, I'll tell what about PPE, all that in this class. So as a nursing student, you should be much more aware of what is asepsis and what is disinfection. Okay, asepsis, what is it? Sepsis means you all know it is infection. Asepsis means no infection or without infection. It means absence of all the microorganism, including bacteria, virus, fungus, yeast, whatever it is that can cause disease. So aseptic technique helps to protect patient from infection. So healthcare professionals should use aseptic techniques in operation theaters, diagnostic labs, treatment rooms, outpatient clinics, healthcare settings. So where all we follow in hospital these aseptic techniques, but while performing surgical procedures, while taking biopsy, dressing surgical wounds or burns, suturing the wounds, while inserting a catheter, wound drain, intravenous line or chest tube in a patient, while administering injection or drawing blood from the patient, while using instrument on patients for examination, and also in deliveries, etc. So what are the methods by which these aseptic practices are made possible in a healthcare setting? There are 4 methods. One is barriers. Next is preparing the patient and the equipment. Third is controlling the environment. And fourth is following contact guidelines. Coming to the first, use of barriers. Why do we have to use barriers and what are these barriers? These barriers are sterile gloves, gowns, masks, goggles, shoe covers, protective wrappers on sterilized instrument that is going to be used on patients. So these barriers prevent the transfer of germs between the healthcare professional, patient and the environment. Second, preparing the patient and the equipment. We must thoroughly prepare both the patient and the equipment before any medical procedure. Like patient's skin has to be disinfected before starting any surgical procedure, sterilizing the equipment and instruments used on the patient before a procedure, keeping all the sterilized instrument inside plastic wrappers to prevent contamination before use. And the third is by controlling the environment. You all know, like theaters, labs, wards, etc. The doors will be kept closed. This minimizes the movement of people in and out of this aseptic field, or it limits only the entry of authorized person into the room, permitting only one patient per aseptic field so that we don't crowd and over contaminate the aseptic area. And fourth is following the contact guidelines. That is, once a healthcare professional dons sterile barriers, they should not touch any object which is unsterile or any surface which is unsterile. If a sterile instrument falls on the ground or the wrapper that is on an instrument is damaged, it should be re-sterilized or it should be replaced. They should follow strict donning and doffing protocol. You know what is donning and doffing? Because of this COVID-19 pandemic, there are several videos circulating in social media telling about the donning and doffing protocol. So, what is PPE? You all know, personal protective equipment. How this personal protective equipment is being used by the healthcare professional, there is a procedure which has to be put on first. So first they should scrub the hands, then they should put on the shoe cover, wash the hands, put on N95 mask, put on the cap, then put on the surgical mask over the N95 mask, put on the goggles, scrub the hand, put on the gown, then gloves, then another pair of the gloves, then only they should enter into the highly infectious area or the COVID-19 ward or attending the COVID-19 positive patient. I am giving example as a COVID-19 because this is one of the highly infectious scenario that we are all facing today. So how do you remove this? That is called as doffing. That also has to be done in a particular order. Like you have to remove the gown along with the gloves, then you have to wrap them and discard into the dustbin which is meant for it. Then put on the pair of gloves, you remove your shoe cover or trauma boot. Then you have to wear gloves. Then you have to wear the, remove the gloves, not wear the gloves. You have to remove the gloves because you have touched the shoe cover or a trauma boot which is highly infectious. Then wash hands, then put on the new pair of gloves, remove the goggles, surgical mask and the cap, then remove your N95 mask, then wash your hands, finally wear a new surgical mask, then go for a bath or a shower, change the clothes, then exit the lab or the hospital. So if any of these protocols and donning and doffing is not maintained, the very purpose of wearing this personal protective gear will be failed. That means it won't protect either the patient or the healthcare professional. So that's about asepsis and how do you practice asepsis in healthcare professional. Then coming to disinfection. So what is disinfection? It is the process by which number of contaminating microorganisms, particularly those which are producing disease or those which are causing infection or pathogenic microorganisms, are reduced to a level which is no longer harmful to health. Okay. What is the difference between sterilization and disinfection? Sterilization means it is 100% removal of microorganism, whereas disinfection means you are only removing the disease-producing microbes to a level that it is no longer harmful to produce the disease. Okay, then what is an antiseptic, or what is the difference between the disinfectant and antiseptics? If disinfectants are the ones which are used on an inanimate object or on a non-living surfaces, if it is used, suppose if it is used to disinfect a floor or an equipment or an instrument, etc., then we call it as disinfectants. What is an antiseptic? If a disinfectant is used on a viable tissue, say for example, you are using it for wound cleaning or for cleaning the skin, then we call it as antiseptic. That's the difference between the two. So what are the properties for a substance to become an ideal disinfectant? It should have a wide spectrum of activity. That means it should act against the bacteria, virus, fungus, and also the spore-bearing bacteria it should act on. It should also act on in the presence of organic matter, that is in presence of urine, sputum, any other clinical specimen, etc. It should act. It should have a high penetrating power. Suppose you wrap all the instruments and allow them to disinfect, it should have a high penetrating power so that it will deep inside it will go and it will thoroughly disinfect the item. It should able to act in acidic and alkaline pH. It should not be corrosive. Suppose you are applying them onto a metal surface, it should not cause any rust on them. It should not be toxic and irritant. That means it should be safe to handle on skin. It should be easy to use and it should be cost effective. And last but not the least, it should have a long shelf life. Okay, general rules for the use of disinfectants. Too much of toxic concentration should not be allowed to fall on the skin or the mucous membrane. And always disinfectants has to be used in correct concentration. If you dilute too much, it will be ineffective, and if it is too stronger, it is going to irritate the skin or the mucous membrane. And always working solution has to be prepared fresh, because once it is older, it won't be effective. And time for active disinfection will vary depending on the microbial load, whether the microbial load is too high, too low, on the kind of the microbe, like whether it is a spore forming bacteria, whether it is a mycobacteria, whether it is gram positive, gram negative bacteria, whether virus, whatever it is. So depending on the microbial load. Next, presence of organic matter, whether specimen is a urine, sputum, or it is a feces sample. And also pH, whether the medium is acidic, alkaline or neutral pH. And also the nature of exposed surface. Say for example, whether the disinfectant is going to act on the metal surface, whether it is going to act on the glass surface, whether it is going to act on the skin, or it is going to act on the tiles or on the floors, etc. So these are the factors which will determine the time of exposure of action of disinfectant. How do you classify disinfectants? We have 9 groups: alcohols, aldehydes, phenols and its derivative, halogens, oxidizing agents, salts, surface active agents, dyes and gases. So from here onwards, it's very important for you. It will be asked in a 5 marks for you, or each of this group will be individually asked, or in 2 marks they may ask, give examples for alcoholic disinfectant, aldehyde disinfectant, or give 2 examples for oxidizing agents as disinfectants, etc. So the real class starts from this slide onwards. So alcohols, what are the examples? Ethyl alcohol and isopropyl alcohol. These are the best example. Mode of action, mainly the alcohols will denature the bacterial protein, thereby they will kill the bacteria. Alcohols are bactericidal, that means cidal means killing. It is effective in killing the bacteria, but it doesn't kill the virus or the spore bearing bacteria. And it is commonly used as a skin antiseptic. You all would have noticed in the hospital, before giving injection or drawing the blood, they will clean the skin area by wiping with 60 to 70% alcohol. That's the common use in hospital setting. Aldehydes. So there are 3 groups: formaldehyde, glutaraldehyde and ortho-taldehyde. Formaldehyde, very good disinfectant, because it is bactericidal. That means it is it can kill bacteria, virus and spore bearing bacteria. Formaldehyde is a gas. When 40% formalin in water is heated, this formaldehyde gas will be liberated. It is used for fumigation of labs, hospital rooms and hospital theatres. In the couple of the next slides, I'll describe to you what is fumigation. 10% of formalin solution is used to preserve the tissues. If you have ever gone to the anatomy lab, you will see the tissues or any clinical specimen immersed in a liquid. That liquid is nothing but 10% formalin. It is also used to prepare bacterial, inactivate bacterial vaccines, toxoids, etc. Glutaraldehyde. This again is a best disinfectant. It is bactericidal, fungicidal, virucidal. Mainly it is having activity against HIV. 2% solution of glutaraldehyde is used. Sidex is the common brand name that it is being used. For what we use glutaraldehyde in a healthcare setting? We use them to sterilize endoscopes, cystoscopes, bronchoscopes, face masks, plastic endotracheal tubes, etc. These are the instruments which are inserted into the body, maybe through the nose, through the rectum, or through the mouth. These instruments will be inserted inside to scan the particular area. So these instruments are heat sensitive. So glutaraldehyde is the best disinfectant to sterilize them. Next is orthothalaldehyde. This is having more activity against mycobacteria, again used to sterilize endoscopes, cystoscopes, and bronchoscopes. Phenols. So under this group, they act by, we have cresol, chlorhexidine, chloroxylenol, hexachlorophane. Again, phenolic group of disinfectants are widely used in hospitals. They act by damaging the cell membrane of the bacteria. So best example for the cresol is the Lysol, which is the common floor disinfectant used in hospital. It is also used to disinfect glasswares. It is active against a wide range of microbes. Chlorhexidine, the common brand names available are Savlon, chlorhexidine has such by the same name, and cetrimide, used for disinfecting the wounds and the skin. It is active against bacteria but not against the mycobacterium and fungus. It also doesn't have a virucidal activity. Chloroxylenol, the best example is the Dettol, which is commonly used by us at home to disinfect the skin and also to wash the contaminated clothes and other things being used on the sick people at home. Hexachlorophane, more active against gram positives than gram negative. That's about the phenolic group of disinfectants. Coming to halogens. So example for the halogens are, you know, they are inert gases. Chlorine and iodine are the best examples, and they are again widely used in a hospital setting. Chlorine is available in the form of bleaching powder. We all know we use bleaching powder even at homes. Sodium hypochlorite, another chlorine compound, and chloramine. So these are used to, mainly chlorine, we all know it is used to disinfect drinking water. Sometimes when it is used heavily, you will feel the smell of chlorine in the water. It is also used in swimming pools and also used to disinfect food and dairy packaging items. Like suppose they are packaging this food and dairy items in particular boxes, aluminum or any other metal containers, those are sterilized by using chlorine. Chlorine compound acts by releasing free chlorine. Say for example, when hypochlorite are added to water, what happens is chlorine will react with water to form oxidizing agent, that is hypochlorous acid will be formed, and this is a effective disinfectant. Hypochlorite solution, very effective against HIV infected materials. They are also bactericidal, fungicidal, virucidal and sporicidal. So this kind of disinfectant, which is having wide range of activity against bacteria, virus, fungus, including HIV virus, even COVID-19, very effective. This hypochlorite solution is very effective in combating all this. So they are very widely used. And one thing is it will decay very rapidly, hence you have to prepare a fresh solution every day. Then next is the iodine. Iodine, you all know, commonly used skin disinfectant. It is bactericidal, sporicidal and has effective on mycobacteria. It is also virucidal. Iodine, when it is combined with a surface active agent, then it is called as a iodophore. So the best example for the iodophore is betadine skin ointment that is being used by us at homes also for any wound. In oxidizing agents, so we have hydrogen peroxide, peracetic acid, and plasma sterilization. So hydrogen peroxide, 10 to 25% solution, it is used to kill all microorganisms including spores. How does it act? It acts by releasing free hydroxy radical by decomposition. Hydrogen peroxide is used to disinfect contact lenses. Those who wear contact lenses, you will all know at night you will remove them, or whenever you are not using, you will remove them and you will immerse in a solution, that is the 10 to 25% hydrogen peroxide solution. All the prosthetic devices, what are prosthetic devices? Like some of the artificial valves, etc., being used on heart patients, those devices, and implants. We have various implants, no, used for bone surgery, knee surgery, or joint replacement surgery, etc. Those implants are all disinfected using hydrogen peroxide. Peracetic acid, again, it is a strong oxidizing agent. It is more potent than hydrogen peroxide. It is used in plasma sterilization. Okay, what is this plasma sterilization? You all know there are three states of matter. That is the solid, liquid, and the gas. Lately, they have discovered another phase of the matter, that is the fourth state of matter, that is called as the plasma. This is in between the liquid and the gas, or it has both the properties of the liquid and the gas. Okay, so this plasma is defined as a ionized or energized gas with an equal number of positive and negative charges on them. A good example for the naturally occurring plasma is lightning that happens during rain with thunder. Okay, that's a example for the natural plasma that exists. And how do we create this plasma? Because it has a high penetrating power, it is used as a disinfecting agent in hospital. Say for example, hydrogen peroxide alone or in combination with peracetic acid, when they are taken in an enclosed chamber under deep vacuum, when this combination of gases are excited using microwave energy, this plasma is generated, that is the gas with equal number of electrons and the protons. This free radicals, they disrupt the metabolism of the microbes, and that's how they will kill them. So this plasma sterilization is widely used in hospital for sterilizing all the disposable single-use items like flexible endoscope, Dopplers, rigid scope, ophthalmic lenses, some surgical drill, etc. Whatever is being used in the hospitals, these are all sterilized by plasma sterilization. Commercially available plasma sterilizers are there, just like your hot air oven or autoclave. It will be there. You have to wrap the items, put it inside and on the machine. Once it is off, it will get sterilized and it can be used. Salts. Salts of heavy metals like copper, silver and mercury are used as disinfectants. Best example is sodium ethyl mercury thiosalicylate, which is called as merthiolate. So this merthiolate is in a dilution of 1:10,000 is used to preserve the serum. Say for example, we preserve serum so that in future we'll do any molecular studies for research purpose. So just like that, you separate the serum and store them, it will get contaminated and the purpose of preserving them will be defeated. So we have to add merthiolate so that it will be preserved. Next is the surface active agents. Surface active agents are the ones which will reduce the energy levels at interfaces, thereby reducing the surface tension. So these surface active agents, they are called as surfactants. So these surfactants, based on the charge, they can be an anionic surfactant, cationic. Anionic means they will be positively charged, cationic means negatively charged, non-ionic means no. charge, and amphoteric compounds mean they will be both having a positive and negative. So best example for the surface active agents as a disinfectant is citavlon and benzalkonium chloride. They are quaternary ammonium compounds, positively charged compounds. They are more effective against gram-positive bacteria, mycobacteria, and viruses. Dyes. So you know, dyes are nothing but coloring agents. We use dyes in laboratory for staining. Some of the dyes, they have antimicrobial activities, so they can also be used as a disinfectant. Based on the chemical compound that is present, they can be aniline dyes, acridine dyes, etc. Examples for the aniline dyes are crystal violet, brilliant green, malachite green. Acridine dyes example are acriflavin, euflavin, proflavin, and aminacrin. They are active against gram-positive bacteria, so they can be used as a wound dressing material or skin disinfectant. Gases. So what are the gases? Gaseous disinfectants can be a 5 marks question for you. So what are the gases which are used as disinfectants? Formaldehyde gas, ethylene oxide gas, and beta-propiolactone. So I told you in earlier under the aldehyde group itself about the formaldehyde gas. How do we get formaldehyde gas? By heating 40% formalin is suspended in water. When it is heated, formaldehyde gas is liberated. This formaldehyde gas is mainly used to fumigate operation theatres, wards, labs, etc. I'll explain to you what is this fumigation. So what is the next gas that is widely used? Ethylene oxide. It is used to sterilize plastic and rubber articles like respirators, heart-lung machines, sutures, dental equipments, clothing, disposable syringes, petri dishes, mainly all the single-use disposable plastic and rubber items being used in hospitals. They are sterilized in massive level commercially using ethylene oxide disinfection method. Next is beta-propiolactone. It is mainly used for inactivation of vaccines. So what is a vaccine? Vaccine is a inactivated or live attenuated agent which is used to induce immunity. So those substances we call them as vaccines. So these vaccines, if they are killed, means they are inactivated by using beta-propiolactone. You have lots of viral vaccines which are inactivated using beta-propiolactone, which is shortly called as BPL. Okay, so these are the 3 examples for gaseous disinfectant. I'll tell you in detail about this fumigation. Using formaldehyde, how do we disinfect the hospital rooms or laboratories or operation theatres, etc.? How do you fumigate? So what you have to do is you have to use 40% solution of formalin taken in a boiler. So this is the machine in which you take the 40% formalin solution. This can be heated by connection to the electric supply. So for every 1000 cubic feet surface area, you have to use 500 ml of 40% formalin. So before you keep this kettle with the formalin, whichever area you're going to disinfect, you have to thoroughly clean that area with soap and water. Say for example, if you're going to disinfect a hospital, all the operation theatre, all the instruments, cupboards, whatever it is present in that particular area has to be thoroughly cleaned with soap and water. Then you have to close all the doors, windows, power supply, ACs, fans, lights, etc. is there. It has to be put off. Then what you have to do is switch on the boiler and you have to leave the room and seal the door. Allow this formalin to vaporize for 45 minutes. Then you have to switch off from outside. You should not open the room and go inside to switch off this. We have to arrange in such a way that you can control this boiler from a switch from outside, or main switch you can put it off. What happens is the vapor that has been generated will fill the entire room, and it will be there for 20. You have to allow it to be there without opening for 24 hours. After that, you have to open the door, enter the room with wearing protective gear, because you have to cover yourself with mask, your eyes also better wear the goggles, because this vapor may be toxic and it may cause irritation to your eyes, throat and mucous membrane. With the protective gear, you enter inside, open all the doors, windows, so that the vapor will tend to disperse. Any residual formaldehyde that is present, it can be neutralized by exposing them to 250 ml of ammonia per liter of formalin being used. This is called as formaldehyde fumigation method, widely used in hospital for disinfection. This can be asked as a short note for you. Gaseous disinfectant, very important. Okay, you might want to know what are the disinfectants used for HIV infected articles. 2% glutaraldehyde, 6% hydrogen peroxide, and 1% hypochlorite solution will be used for disinfecting the HIV infected articles. Disinfection of safety cabinet. This safety cabinet you would have seen in the laboratory. This is the one. Suppose if you are using a highly infectious material, that material has to be handled inside the safety cabinet. This can be sterilized by switching on the UV light which is there in the safety cabinet on the roof, or by using the fumigation method using formaldehyde. Okay, what is best for COVID-19 infection? Because now we are battling against the pandemic caused by COVID-19. Best is wash hands frequently with soap and water. For indoor and outdoor cleaning, what is being used is the 1% sodium hypochlorite solution, that is the bleach. This is called as fogging. You see, nowadays, wherever COVID positive cases are there, people with protective gear will come and do this spray. This is called fogging. What are they spraying is this 1% sodium hypochlorite solution, which is having very good virucidal property. Okay, another thing I want to tell you is the sterilium. You would have seen, at the bedside of the patient, one hand scrub will be kept, where doctors and healthcare professionals will often scrub their hand. You might want to know what is it. It is nothing but an example for an alcoholic disinfectant. Mainly it contains propanol. 1 and 2 propanol will be used along with a skin conditioner like glycerol, and a fragrant substance will be there. So that's all about this class, asepsis and disinfection. Any doubt, students? Any doubt? Do you want me to explain any part from this class again? Hello. Any doubt in the class? You want any part to be explained again? Hello? முடிச்சிட்டேன். ஓகேங்க சார்.